Hi, welcome to this video. So today I want to answer a question. And one of the questions that came to me was that actually has come in my inbox. Sometimes they come anonymously, but it was someone wondering that they have been a respiratory therapist and they're trying to see if they could get a master's in clinical informatics. Okay. And they're wondering if they should do that. Should they go into health IT or data analysis? So I'm going to talk a little bit about that. So first things first, one of the things that people should know is that usually when you are going to do like a master's or something like that, they tend to want someone who's had experience either on the clinical side. By the way, this is clinical informatics, so it's not necessarily healthcare informatics, it's clinical. So what that means that it has to do on the clinical side. So usually the requirements, by the way, whenever anyone wants to get either maybe a certificate or like in this case, this person wants to get a master's, they usually will have some requirements. And some of the requirements may be that you have to have some prior experience, knowledge about the workflows of the industry, okay? And so, and this ties into one of the questions I think I had before. And so, for someone who's been a respiratory therapist, that is actually very good, that you can do that. This is specifically people who are, like I've talked about before, you're in healthcare already, healthcare as a as a clinician or anything like that. And then you're looking to see if you can transition into some other part of healthcare, okay? You do have options for sure. You can go into the healthcare IT side. You can go into still the healthcare side, but in a different way. You may not be bedside, for example. You could be someone maybe who's giving advice or care navigation for those companies that are providing care via telehealth and things like that, okay? So with that said, again, going back, usually they're going to need that you have some prior experience, okay? And so is someone who may want to do certification. So if you are someone maybe that's coming from another industry, but you've done data analysis, however, that you may not have done worked before in the healthcare side, sometimes the requirements may you may have to take a bit of time before you actually get the certification. However, you can still work in the industry, just the certification part of it. Like me, the other part of me is I'm a certified project manager. And to be a certified project manager, you had to have had some prior experience or done some specific hours they specify. I won't go into the project management side, but I'm giving you some examples of having managed some projects. It's the same thing, okay? And this is universal. It's not just for healthcare. It's usually for any other industry too, that if someone wants to get certified, they may want prior experience in that area, okay? So be very aware of that if you're someone who wants to pivot. Again, this is if you want to get certified right away. For a master's, this particular person actually you can go and do the master's in health or clinical informatics that they want to do. The only thing is that I think there are options that could take you a bit shorter time than a 2-year master's. However, it also depends on what someone's goals are. They may want to perhaps get into leadership, okay? And yeah, you then can go for a master's. Also, you could put finances into consideration, a master's. This takes a bit of more money. Is that what you want to do? In case you don't, if that's what you want to do and you're okay with it, absolutely go for it. But what I'm trying to emphasize is that if that's not where maybe immediately you want to do, like going to leadership, also, I wouldn't advise someone to go straight into leadership in a new industry, perhaps that you're in. The reason for that is that it's very good to have some industry knowledge of that area, especially something like healthcare. Probably you may not get in right away, because usually they want someone who has prior experience. So my suggestion would be get into a position where actually you're going to participate. Like in this case, you'd be a clinical informatics analyst, and you gain the experience, you get to know the workflows and things like that. As a clinician, this person already has some idea of what that would be, but not all of it, because it also depends where you want to be. If it's actually in the area of respiratory therapists or respiration or anything to do, let's say, with pulmonary, anything vascular, pulmonary, those areas that have to do with the breathing, the lung, that kind of thing. Absolutely, that's okay. But if you're going to be in maybe some other areas, depending, because healthcare has different areas. I won't go into them right now, but it has different areas that you could go into. Nursing is one of them. Supporting the physicians also is one of them. And by the way, these areas in the end, aside from maybe the nursing division, the nursing administration, the nursing CMO, chief nursing officer, offices, or things like that, you may find that you may be supporting the decision support team. Okay, that's also a specific team. And these are usually teams that in different capacities that use the healthcare analytics, in this case, the data analysis, because data tells the story if you analyze it, to know what's going on and therefore what they need to do. What steps does the hospital system as an organization need to do? Okay. So to answer the question, essentially, yes, you can absolutely get into from clinical side, whichever clinical side you are in, nursing, respiratory therapies, physical therapy, anything else. And you can go into any kind of informatics, clinical informatics and things like that. Okay. What I would suggest perhaps is that if you don't want to get into leadership right away, even though you've been in healthcare, absolutely you can get like a certificate, because your clinical experience is going to count towards the prior experience they usually need, experience or knowledge that they'll need. Okay. For example, I've looked into the clinical informatics. In some of them, in some certification types, they would need like someone who has at least done some kind of analytics before, which that part is actually very good for someone who maybe is moving from a different industry, has done data analysis or any kind of analytics. They want to move into healthcare, and with that, do any analytics, clinical, anything like that. Okay, so that it would be a good thing. They usually have seen on average, they may need like 5 years. And the thing though, they say sometimes of those years, depending on where you're getting it, they may need some experience within the healthcare industry. Okay. But if you're someone maybe now coming from clinical side, you already have that. So that will be good for you. All right. So with that said, know what first things you have to know. What is your goal? Do you want to go into leadership? If you do, absolutely go for master's, do what you want. But also if you do, but maybe you don't want to go into that area, or also if finances are a hindrance, you don't have to do the master's right away. You can actually go and be a clinical analyst, and that is also a very good area. Okay. And then from there you see. It also helps because sometimes you may want to go for a master's, but then maybe you find out that it's not the area you want to be in eventually. All right. But if you're sure, absolutely you can go for it. Okay. I'm not saying you don't go for it. I'm giving you things you need to think about, or you can think about. to make your choices or to make your decisions. All right. So hopefully this is helpful. Think about the goals you want for yourself in order to make those decisions. So the goals could include where do you want to work eventually? Is it leadership? Is it analyst? And then make the decision. Do you want to go for a master's or certificate? You can do either one, okay? Master's is going to be more difficult. Certificate is going to be, sorry, not difficult. Master's is going to take longer, 2 years or more. And also it's going to cost more. Okay, certificate is going to take a shorter time. They tend to take short time. They'll have the requirements. You do some reading or something. Of course, you have to prep for it. Okay, and in order to prep, it will take maybe it could be anywhere from 1 month to 3 months. The reason for that is if you're working. Okay, but if you take time off, it could even be shorter, maybe 1 month, 3 weeks. You do your reading, and then you take your exam and things like that. Okay. Next also is that absolutely anyone can move into the informatics division or informatics area. But the thing that would count towards that is your background. If you're already a clinician, nurse, respiratory therapist, physical therapist, or any other type of clinician, absolutely you can go into it. If you're coming from a different industry, but you have the data analysis or analytics already under your belt, what you would need to learn is to learn at least the workflows. That helps you to decide where exactly you would like to be. Okay. And that is an area also I do help in. So if you're interested in knowing, for example, it's called the Healthcare Workflow Mastery, program. And I help you, we really go through the different workflows of the patient journey and what happens behind the scene. When I say behind the scenes, is the back-end operations and things like that. It helps you to know from beginning to end so that you can know maybe which areas do I want to work in or focus in. Okay, because all those areas use reporting. We call it reporting usually in healthcare. They use reporting, or it can be called analytics, either one of them, because you're running reports. You're going to give the reports of the data. And sometimes you're going to slice and dice that data. Since you're already in that, that area, you must know what I'm talking about. But I hope this was helpful. I don't want to make it too long. If you have any other questions, or if you're interested in actually doing that healthcare workflow accelerator program, let me know. Give me a shout, send me a DM or my email, and we can get together. I mean, we can just have a chat and see if, it's a good fit either way, either for you or for me. And then we'll go from there. Otherwise, I hope you're doing well. Again, remember, you don't have, if you're someone maybe, especially who's been perhaps laid off, or is someone looking to transition, you can do that. The other thing maybe I wanted to show you is that some people were saying, hey, are there more jobs because now of the changes in the funding, healthcare, and all of that. The jobs are there. It depends where you are. Okay. So let me do a quick demo. It's not a demo, sorry. I'm just going to show you actually what the jobs are. It's project management. So let's see here. Okay. Gonna do a quick here. I want to just show you so you don't think. Now, this is only actually from one platform, which is LinkedIn here. I just want to show you what the jobs, for example, I'm in New York metro area. I'm actually based in Connecticut, but fortunately, we're like, in between two big cities, Boston and New York. So they tend to take Connecticut under the New York metro area. So that's why. Anyway, I did a quick search here, and I'm using the platform that has the biggest market share, meaning it's been implemented in more hospitals around the country, which is Epic Systems. And I just did a general, not a specific type of Epic model. It's a general model, sorry, general search of Epic analyst. Okay, and I get 51 results in the New York metro area. Remember, these are not the only ones, but I'm just doing a quick search here on LinkedIn. Not all the jobs are posted here on LinkedIn, but just to give an idea, okay? So as you can see, those and the salaries are very good. That's another thing. Six-figure salaries, especially if you have the experience, prior experience, you'll be able to get into that area. So here, as you can see, result of 151, which is a good actually result. The average really is within over 6 figures in terms of salary. So this is a very good career to get into. Okay, and for any clinical clinician that wants to transition, same thing. I've also talked about for clinicians that this particular question, excuse me, did talk about, I'm going to stop sharing. It was asking specifically about clinical informatics. However, I want you to know, even as a clinician, that's not the only area you can go into. You can also go into, right now, there are many health AI companies that are creating solutions that have primarily been known in the industry, and they're creating those solutions. So they do need also clinical or clinicians to help them design in product or in workflow, or even in other roles, but within you as a clinician. They need your your knowledge, your experience. So you can also look in those different areas, not just informatics that you can go into if you don't want to be bedside, okay? Bedside or patient care type thing, all right? So just I just wanted to put that in there. All right, thank you so much. I hope this was helpful. Talk to you next time.